Hello, this is Dr. Mareedu. I'm an interventional cardiologist. Since my childhood, I was always fascinated by the field of medicine, and because probably I did not understand how things work at that time. So that got me interested in biology and further into medical field. My interest in cardiology dated back to medical school. In the first year of medical school, we have a subject called physiology, wherein we study about each organ and how it works and what makes it work the way it does. And cardiology and the heart as an organ just made a lot of sense to me with regards to how it functions. As I got further along in training, I realized that we can do a lot of things that can affect a patient's lifespan and morbidity in the field of cardiology and interventional cardiology, which is why I came into this field. As an interventional cardiologist and also an endovascular specialist, I fix blockage in the blood vessels of the heart and the legs. So there are two kinds of subsets of patients I see. One subset would be very sick patients at 2 o'clock in the morning having a very serious heart attack. So we come in rushing, we try to open the blood flow to the heart, and we kind of stop a heart attack in its track. That gives a lot of pleasure and satisfaction to all of us because we are affecting patients' care very acutely, short term and long term. On the other side of things, I see patients in the clinic. So I follow them for years and years. And I didn't realize that in my training, but now I realize that I'm almost like a coach to them. I kind of coach them to lose weight, to lead a healthy lifestyle. Preventive part of cardiology also gives me a lot of pleasure. The field of cardiology has so many fancy new technology. We can do a lot of things for the heart. We can put a new heart in if needed, right? So you want the doctor to guide you to do the right things at the right time, understanding your goals, short term and long term, and your philosophy of life. So I hope I can be that guiding force in addition to bringing a lot of technical expertise and scientific know-how in managing the condition. The first rule of medicine is patients do tell us what their problems are. If you listen to them, you're able to understand a lot of things. In this day and age with the electronic system permeating our healthcare, I think it's important to kind of set aside, look patients face to face, and then sit down and listen as to what's going on. I have a 3-year-old and 1.5-year-old at home, so they keep me pretty busy. Like playing tennis, running, traveling, among other things.